Arts' healing mission is to bring the therapeutic benefit of art to those touched by cancer and other chronic illnesses. We do that by offering free classes to patients, their loved ones, caregivers, family, to come together in a very safe environment. One of the signs that you know that you have reached an Arts' healing class is you walk into a store, you ask someone where Arts' healing is, the class. You're there for the first time, and they say, follow the laughter. Always, we have a measure of less stress. Depression has been lifted for the moment. Health issues have been set aside. As an artist, I know what the feeling is to create and the process that you go through in order to have that finished installation. I also know as a cancer patient what it feels like to be on that side of the disease. So bringing the two together is a very, very important component to me personally, because I've been there, done that, have felt it. Now I know that I can give that back to others and make a difference in their lives.
Home Sweet Home is a nonprofit furniture bank, so we provide furniture and household items for families in need, and we do that by partnering with 15 area agencies. There are 60 other furniture banks in North America. There just wasn't one in an organized structure here. So we took what we had learned in the past, just put it all together and said, we can do this, and the agencies play a really important role in that partnership with us. In the 2.5 years that Home Sweet Home has been around, we've provided furniture and household items for more than 730 families. And it's that feeling that we provide. It's so much more than just furniture, but it's this feeling of warmth and kindness, and that the community has cared about them enough to provide this service and to be able to deliver that furniture to them. And so when we talk about Home Sweet Home, we say it's really more than about the furniture. It's more about that feeling that we can give. I would like our legacy to be the fact that we have built community through providing this furniture and fulfilling this need. That we find a way to build the gaps and the bridges, no matter where they live in the city or the county, and we find ways to build those relationships. That would be an amazing legacy to leave. We know that we would be done with our mission when every child has a bed to sleep in.
Missouri Coalition for the Right to Counsel has a collaborative relationship with the Missouri State Public Defender to help the public defender with their caseload by having lawyers in the private practice take cases. The benefit to the private practice lawyer then is an opportunity to try a jury case. We take cases, our volunteers do. That helps them in terms of their caseload, and it gives a reasonable opportunity for our volunteers to try jury trial cases. We've trained, since this program started less than a year, over 250 volunteers from 38 enrolled law firms. And we've assigned out, or the public defender has assigned out, 150 cases to date. We wanted to do this program because it was the right thing to do, and also it was the smart thing to do. What we want the organization to do ultimately is to, by virtue of what people are volunteering to do in the Missouri Bar, that will lead to opportunities to have others argue that the public defender is deserving of more help.
STARS is a program that's uniquely designed for children with special health care needs. We develop a care plan that's specific to the health care needs of that child. We share that care plan with first responders in the field. We educate them in advance so that the first responders have the information available to them when they need it to provide the very best care they can for these children. This program is the first of its kind really in the country. Before this program, there was an information vacuum. A child might be discharged from the hospital and there was no communication to the first responders that may have to respond to that child in the event of an emergency. This program fills that gap. So what started out as a program designed to meet the needs of children that were receiving care at Cardinal Glennon Children's Hospital that had special health care needs has really blossomed into a program that will serve kids throughout the state and throughout the region. And there's interest across the country in developing similar programs in states throughout the U.S. The impact of this program is tremendous. It is actually saving lives in the field. Kids are getting the treatment that they need when they need it by caregivers that are prepared to respond immediately and effectively.
We are thrilled that other people with different sets of eyes have come together, viewed arts as healing, and they understand our goals, our missions, our future, and our continued growth to help others.
and the other organizations that have received the award are tremendous, and they're doing things. And for us to be part of that group is a big deal for us.
It's a great validation for the individuals that are on the team that have spent countless hours designing the system and really being the champions of the care for these children.
It's important to have these connections and these relationships and have this visibility. And so we're excited what that will bring, not only for Home Sweet Home, but the agencies that we partner with and the clients that we'll be able to serve in the future.